Hi, my name is Lisa Perna. I'm the owner and medical provider at Revival Recovery Center. Revival Recovery is a Christ-centered outpatient medical treatment center for substance use disorder. I'd like to review the different types of FDA-approved medication-assisted treatments for substance use disorder. First, I'll start with alcohol use disorder, MAT, medication-assisted treatment. So there's disulfiram, also known as Antabuse for the trade name. It came out in 1940. It's an alcohol deterrent that causes adverse effects when combined with alcohol. This medication is taken daily, preferably the same memorable time. If compliance is an issue, having someone administer the medication is advisable. The most common side effect is fatigue, and if that happens, you can take it at bedtime. More serious but rare side effects is optic neuritis, peripheral neuropathy, and liver toxicity. So checking for vision changes, distal extremity numbness and tingling, and liver function will be important. Of course, you want to stay away from alcohol products. Things you might not think about would be like cough syrup or mouthwash. Things that you put on your skin could potentially cause some redness, so it's important to just maybe use a little bit on your skin before putting it on a large surface. The next one is a compressate. The trade name is Campril. This one came out in 2004. This helps to restore the natural chemicals in your brain. It helps to decrease the rate of relapse and the quantity and frequency of alcohol intake. This one is 2 tablets 3 times a day, which can be a barrier for some. This medication doesn't have potential for liver toxicity, unlike disulfiram and the next one that I'll talk about, Naltrexone. So that would be a preferred medication if there is a compromised liver. The next medication is Naltrexone. There's immediate and extended release. This one came out in 1994 for the immediate and 2006 for the extended release. The immediate is a 1-tablet pill daily, and the extended release is an intramuscular injection that you get once a month. This helps to reduce cue-induced cravings, and it decreases the rewarding effects of opioids and alcohol. So Naltrexone is for alcohol use disorder and opioid use disorder. The most common side effects is upset stomach, headache, dizziness, lightheadedness, weakness. Side effects are usually minimal and transient. The most serious side effect, which is rare, is liver toxicity, and you'll be getting your liver function through blood work checked while you're on it. But for opioid use disorder, it's going to create a complete blockade over the opioid receptor, making opioids, if taken in, ineffective. To start Naltrexone, you're going to be given a challenge dose. This is like a test dose, usually given 5 to 7 days after a short-acting opioid, or 7 to 10 days after a long-acting opiate. We need to make sure that the person is motivated because Naltrexone can increase the sensitivity to opioid receptors, which can increase the potential for overdose if opioids are used following naltrexone cessation. Research shows that using the extended release naltrexone is more effective than using the oral medication for opioid use disorder. Next is buprenorphine. This is for also opioid use disorder. So buprenorphine has a very high attraction to the opioid receptor. It has a very good safety profile. It provides an opioid blockade, making full agonist opioids ineffective. Those who choose buprenorphine are those who may not be ready to come off of opioids. This is a harm reduction route. It's substituting a harmful opioid with a safer one. The goal is to find the smallest dose that eliminates opioid cravings and withdrawal symptoms. This is done starting when the person has moderate withdrawal symptoms. The first phase is called the induction phase. and it's usually done over 3 days. During that time, you'll be seen usually daily in the clinic or virtually to see how you're doing. The goal would also be to have no withdrawals for over 24 hours. When the person is ready to come off of buprenorphine, they need to, the key word is ready, and it should be done slowly, usually outpatient. If you're interested in coming off of substances and need help, you can book an appointment through our website or by calling 1-833-7-REVIVAL. That's 1-833-7-REVIVAL. I'm located in Brighton, Michigan, off Grand River, just minutes from US 23 and I-96. I offer in-person and virtual visits. I look forward to working with you.